Hello, my name is Chloe Villano with Cloverleaf University, the nation's first approved cannabis and hemp university by the Colorado Department of Higher Education's Private Occupational School Board. And today we're launching our Leaf Talks podcast series, Sports, Meds, and Money, with some of the best doctors, attorneys, and athletes in cannabis to talk about sports medicine, research, cannabis in medicine, and cannabis in education. So for our first panel, we're going to discuss cannabis in medicine with the wonderful Dr. David Bearman, who is the founder of the American Academy of Cannabinoid Medicine, and Dr. Dhanabalan from Global Health and Hygiene Solutions and Uplifting Health and Wellness. Thank you guys for being here today.
Thank you.
So Dr. Bearman is one of the most clinically knowledgeable physicians in the United States in the field of medical marijuana. He has over 40 years of working in substance and drug abuse treatment and prevention programs. Dr. Bearman was a pioneer in the free and community clinic movement, and his career includes public health, administrative medicine, provision of primary care, pain management, and cannabinology. And Dr. Dhanabalan is a Harvard graduate, a very respected and educated physician. She completed her Bachelor of Arts at Rutgers University and got her medical degree from the University of Medicine and Dentistry in Newark, New Jersey. She did her residency at the Medical University of South Carolina, and she completed her Master's in Public Health and residency in Occupational and Environmental Medicine. So thank you both for being here today.
Thank you.
So I know we have an incredible session planned here, and we'll just jump right into it. Talking about this billion-dollar industry and how fast it's moving with so many patients and so many people that have really taken to cannabis, not just for recreational purposes, but for medical. And I know many people think that all use is medical use. But, I want to just jump into the medical conversation and kind of hear from you guys what I would like to hear about your individual practices and what you've been focusing on in cannabis.
All right, so let's talk about my practice. My office is located about 3 miles from the University of California at Santa Barbara. And when we started, one of the things we wanted to do was to make sure that the people that came in here were people who had a real need for the medical use of cannabis. So we pre-screened them by asking 3 questions. What's your medical condition? What treatment have you received? And when was the last time you got treatment? And by that, we were able to screen out those people who were sophomores at UCSB who said, well, I can't eat and I can't sleep and I don't believe in doctors. And so we did not make appointments for them because they weren't going to qualify for a recommendation. I spent about an hour with each patient. A lot of people, particularly early on, were very afraid of cannabis and they were afraid of getting dysphoria. And so I give them a little education about the endocannabinoid system and about cannabis. Then, of course, I take a history. Before that, I have gotten their medical records and reviewed them as well. And then I do a physical, and then I answer any questions that they have, and I discuss dose with them. And I have most of them come back in about a week or so to find out how the dose that they started worked and whether or not they had any side effects. Of course, I tell them to call me if they have any side effects that are a problem. When I first started practicing cannabinoid medicine, which was in 2000, and I wasn't a stranger to cannabis, I helped start the 3rd free clinic in the country. I volunteered at the Haight-Ashbury Clinic. I ran their drug treatment program. The list goes on and on. But while having familiarity with cannabis, I did not have intimate familiarity with the broad expanse of conditions that respond to cannabis. And I think that, to me, has been one of the most eye-opening things are people with cancer, people with phantom limb syndrome, people with Crohn's disease. And the list goes on, and I have just been amazed at what I have learned from my patients patients in terms of the conditions that it benefits them, the dosages that they take, and it's expanded my understanding of the endocannabinoid system and the human body. So we'll stop with that, because I could go on and take up the whole hour here, and I don't want to do that.
Okay, thank you.
Thank you, Dr. Bearman. Dr. Bearman has been a mentor of mine. Was not introduced to cannabinoid medicine until actually 2010. And so this marks 10 years for me of understanding that we have a system known as the endocannabinoid system. With all my fancy education, I had never, ever, ever learned that there was this system that existed. And if anything, I'm also a medical review officer. So I was on the end of testing patients. And if they tested positive for this chemical known as THC, many of them lost their jobs and their livelihoods, because on a federal level where it is today, it is still illegal. It is still not considered as an option for most patients, especially if they work in federal positions. And I also did Department of Transportation physicals. So my array of background has also been in heavy metals. And in my clinic now, I see patients of all ages. Our youngest is 4 and our eldest is 98. And as Dr. Bearman mentioned, the array of conditions for what cannabis can be used for is multiple. And I look at it for 3 aspects. I look at it as far as preventative health, how I can maintain one's health to improve their quality of life, and also for treatment. And ultimately, every one of us, as I say, has an expiration date, and we want people to have the best quality of life that they can have. And in my practice, I am many patients' primary care physician. It is not only about getting their certification done, but I actually educate them, embrace them, and empower them. And that's been our tagline at Uplifting Health and Wellness. And I've been in Massachusetts since 2014. And what I also incorporate, as much as what Dr. Bearman has done, is some of the principles of the American Academy of Cannabinoid Medicine. We actually follow our patients. I see them. I make sure that we have understood where that patient is coming from, because most of our patients can vary from no experience with cannabis, cannabis naive, to what I consider as self-medicating. I don't use the word recreational because I do believe that it is all medicinal, and it's just how you use it. And also the people sort of in my age group that had it when they were younger and now are learning about it as a safe option through their children or other peers as well. So I love what I do, and I'm proud to say I am a diplomat in the cannabinoid medicine specialist and certified by the American Academy of Cannabinoid Medicine.
It's definitely an honor. Such an honor to have you both here today. So I want to ask you, what type of research are you seeing in this industry, and why are we conducting these type of research studies? I mean, I know we founded the endocannabinoid system, and we've had these, Technion Institute and these universities start to really push research, which it is the second year actually we've been even allowed legally to really research this plant. So tell me a little bit about what you guys are seeing out there.
Well, in order to do research, most of the research has been really done to look at the negative aspects of cannabis, not to look at the beneficial aspects, and to the war on drugs and the developing brain and some of the brainwashing that literally I have heard, your egg, your brain on drugs, and with the cracked egg, and how we were taught that this was a drug of abuse, not a drug of use as a medicine for treatment. And I've had to relearn so many aspects of this. And what I really understand is that 3 organizations are involved in order for research to be cleared. You need NIDA, you need the DEA, and the FDA all have to approve us in order to be able to do research. And since cannabis is still federally illegal, it is still difficult. But many countries, primarily Israel and other countries, are far ahead of the game because their countries are embracing this and wanting to know the answers. and wanting to know how many other things are out there that we still don't know about. I mean, cannabis is just the tip of the iceberg of what is out there that we could possibly understand and to help people's lives.
So let me talk a little bit about the research and what we need to do in order to get this more accepted. For one thing, I think that Dr. Raphael Mechoulam, the man who isolated and characterized the chemical structure for THC, should be given the Nobel Prize for Medicine or the Nobel Prize for Science. And I think that would really get us to have a complete sea change in the way people looked at this. I think the other thing that would be useful is if some prominent person, say former President Obama or even President Trump, came out and said that cannabis should be rescheduled. The reason, as Dr. Uma pointed out, that we're so far behind other countries is that cannabis is a Schedule I drug, and you have to jump through a bunch of hoops in order to do this research. It's just not possible to do this research in an easy way because of all the bureaucratic barriers that have been put there. They were put there by Richard Nixon, the last president who operated in a chaotic situation. And both of his people in his administration who were in NIMH and National Institute of Health, Dr. Cohn, Dr. Brown, thought that cannabis should be treated, say, with like no more serious than a traffic ticket. And so Nixon didn't want to have the doctors involved, and that's why he created NIDA, the National Institute of Drug Abuse. And again, as Dr. Uma said, they are looking at dangers. And we need to take a look at its use for autism spectrum disorder, for post-traumatic stress disorder, for attention deficit disorder, for cancer. Those studies are going on elsewhere in the world. And, you know, anybody that's interested in promoting jobs, and you have both Biden and Trump talk about that, has to take a look at the use of cannabis as medicine, because we're giving away these jobs in terms of creating medicines. Now, I'm not a big fan of the pharmaceutical industry, and so I think the use of cannabis sort of outside the bureaucracy is not a bad idea, and having it available as an over-the-counter preparation. After all, in 1988, after a 2-year rescheduling hearing, the DEA's chief administrative law judge, Francis Young, recommended rescheduling cannabis to Schedule II, which, by the way, is what the House of Delegates of the AMA asked for in 2009. In his finding of fact, Judge Young said that he felt that cannabis was one of the safest therapeutic agents known to man. And quite frankly, had John McCain used cannabis for his glioblastoma, because there was a study that was done in England that showed that you lived another 220 days, I doubt whether or not Brett Kavanaugh would be on the Supreme Court, because Senator McCain would have lived 220 days longer. So in talking about research, I do think that we need to focus more on research that's going on in Israel, in England, in New Zealand, in Australia, and recognize that the United States, as in so many things, is no longer the world leader.
Right.
Yesterday was the anniversary, October 7, 2003, when the United States of America was issued the patent number 6630507, which clearly states cannabinoids as an antioxidant and neuroprotectant. So right now, cannabis is in Schedule I because it states that there's no medical use, no medical research, and a potential for abuse. And we know that the research has been done and the government has a patent. So why would the government have a patent if the research wasn't done? And many people do not know that it was prescribed by doctors in this country, and it was in the pharmacopoeia from 1850 to 1942. And today we don't have that liberty. Dr. Bearman and I can only make a recommendation for cannabis because it is still federally illegal. And nobody's ever died from this plant fatality. So this is still work to be done and through education.
Right. And it's so interesting because here we are passing medical marijuana laws all over the country where people can get a recommendation and they can go in and they can buy cannabis, but we can't really tell them how much they should take or what they could use. So I think the tipping point is coming where we're going to have to, or we're going to legalize marijuana. We're paying, over millions and millions of dollars in taxes on it. So, it's going to be interesting to see what research studies come out in the next decade and what we're able to use for cannabis as medicine. It's very exciting.
Now, I'd like to jump in and build on a couple of things that Dr. Uma said. But one thing is, in terms of research, the state of California did open up a research center at UC San Diego School of Medicine, and that was about 2000, and they were the first one, and they did 18 FDA-approved studies, and that was very hard for them to get that done. All of them were designed to show harms rather than benefits, although they did show some benefits as kind of a side product of that research. There now are currently cannabis institutes at UCLA and UC Irvine, and so I think we're going to see more action there. One of the things that the American Academy of Cannabinoid Medicine has pushed for is for teaching doctors about the endocannabinoid system. We'd like to see them teach about cannabis as medicine, but let's start with teaching about the largest neurotransmitter system in the human body. And I'm a big history buff, and if anybody that's interested in history can buy my book, Drugs Are Not the Devil's Tools. And in there I talk about the fact that in the 1920s, American doctors wrote 3 million prescriptions a year that contained cannabis, and in 1937 the American Medical Association testified aggressively against the Marijuana Tax Act. And Dr. Uma is a big supporter of the American Academy of Cannabinoid Medicine. And if I may, I'd like to read two things off of our brochure. The AACM recognizes that many constituents of cannabis are useful in treating a variety of illnesses. The AACM bases its assessment on the thousands of scientific studies that have clearly demonstrated the medical utility of cannabis and cannabinoids and its 4,000-year history of medical use. And then our mission statement, and we talked about this as we were preparing for this. The AACM was founded in 2006 to establish a professional organization to recognize the medical professionals, researchers, and clinicians who support ethical guidelines in the field of cannabinoid medicine and promote greater understanding of cannabis, cannabinoids, and the endocannabinoid system. Our mission is to facilitate medical dialogue regarding cannabinoid medicine by doing outreach and education, promoting high practice standards, and encouraging scientific research and providing practitioner certification to qualified members. And I think that's right on point in terms of the research that you're talking about, because when these people come in, that Dr. Uma and I and others are seeing that have medical conditions that respond to cannabis, in many ways, in many cases, we don't know what the mechanism of action is. And the endocannabinoid system is really giving us a much clearer picture of how the brain works. And there must be more research, not only on the clinical applications of cannabis, but on the basic science that pertains to the endocannabinoid system.
Absolutely. And what we've also heard is that the endocannabinoid system is pretty much involved in every type of disease out there. If the system is not at homeostasis, that's what this, in one word, if we had to explain to anybody out there, what is the function of this endocannabinoid system? It is about homeostasis, balance, bringing one to ease. And as I say, if you are not at ease, you are at dis-ease. And that's where everybody is different. And that is another thing that is very difficult for healthcare providers, because we are very much taught in how to make a diagnosis and make that code for that diagnosis, disease, or the condition, and to follow an algorithm for treatment. And as the word that we keep using here is dose. And the word that I like to use is titrate, because it is about individualized medicine. And what I consider myself is that I'm not only a primary care physician, but I provide care that's personalized for every patient, because that's what cannabis is about. It's about understanding how cannabis works and how you make it work for you appropriately and safely.
Right. Tell me a little bit about what conditions you guys have seen in your patients, and what benefits have you seen in your patients from giving them cannabis?
Okay, well, I will start off with a 9-year-old girl who had severe autism. She was unable to speak. The parents brought her in, and I usually start children off with Dhanabalan or Marinol because it's a prescription drug. And then I say, look, if this doesn't work so well, you can try cannabis. At any rate, they did. And they came back in a week later and said that they had never seen such improvement with prescription medications, and that there was a 30% improvement in the child's behavior, and that this was recognized by the special needs teacher and by her assistant. So that's sort of one of my stories. I have another patient who has Parkinson's disease who is a painter, and he came in 2 years in a row, and each time gave me a painting, and he said, "Doc, I wouldn't be able to still be painting if it weren't for you." And I said, if it weren't for cannabis, you wouldn't be able to still keep on painting. But I love your work, and I'll take your picture. I was really blown away by a woman who had quadriplegia very severely. Came in here with her caregiver, and found that cannabis gave her relief for the pain that she had as part of her very serious paralysis. There are all kinds of pain conditions that people have that benefit from cannabis. And that is the number one reason why doctors like Dr. Uma and myself recommend cannabis. I think the other thing that is really important is the fact that we know that cannabis kills cancer cells. But I can't tell my patients that cannabis cures cancer. I can say, if your mouse has cancer, it will cure your mouse's cancer, because we've done all kinds of animal research in this country. Now, I did mention the glioblastoma study that was done in the UK, but they used about 1/6 to 1/2 of what a panel of cannabis experts or cannabis and cancer experts said was the minimum dose that you should use, 300 to 800 milligrams a day for at least 3 months. And then most cannabis experts would say you should use a smaller amount as a maintenance dose over your lifetime. So the span of medical conditions that we see is enormous. I see a lot of people with attention deficit disorder because I've written on that, a lot of people with post-traumatic stress disorder, and I'm sure that Dr. Uma has as broad or broader a spectrum of cases that she's seen.
Absolutely. It's very much like your stories, Dr. Bearman, is that my patients also, I noticed the word chronic pain. They've lived with pain for a long time, or they come in with lists of medications that go on, and side effects from the medications that have been given to them. So what I really believe is that this is a much safer alternative. I consider it for harm reduction. If you can at least think about harm reduction, when over-the-counter medications such as aspirin, ibuprofen, and Tylenol are available, and each of those medications can be overdosed to a point of fatality, why can't we consider cannabis as a safe alternative, is my question to people.
Right, when we already know that it works. Um, so my next question is, with COVID, I mean, we saw that COVID made cannabis an essential business, which really was a huge step for cannabis. I know a lot of people haven't won in COVID, but cannabis kind of did. Um, so what are you guys kind of seeing now that, have you seen any correlation? I mean, I've heard there's a couple research studies. Have you seen any COVID patients? What's been your personal experience during this time?
Um,
Well, go ahead.
no, Dr. Berman, go ahead.
So when I say we, the executive director of AACM and the woman who was who's a consultant and was the editor of Cannabis Now, we wrote a piece called Cannabis and COVID-19. And we did a little research on it. And what we concluded is that because of the anti-inflammatory effect, it may be helpful in preventing you from getting COVID-19, and it may be useful in making the symptoms less severe. We also, though, felt that smoking cannabis was not a good idea because it causes a greater sputum production and greater inflammation in the lungs, therefore making the environment more hospitable for the virus. So we would say don't smoke it, but use a tincture or an edible, particularly if you're getting therapeutic relief from it. Now, I do know that I was contacted by a research outfit that wanted to look into this, but I don't know of any research that's been completed on the use of cannabis in conjunction with COVID. But if you don't smoke it, it looks like it may have some potential benefit. As we know, a very powerful anti-inflammatory dexamethasone was given to the president, and one of its side effects is it can cause confusion. It's a little hard to tell the difference between his normal confused state and whether or not the dexamethasone exacerbated that. But cannabis does not cause that kind of confusion, and it is an anti-inflammatory. Not as powerful as dexamethasone, but it may still have some beneficial aspects to it.
Great. Doctor,
Hello.
I think you're muted.
I'm sorry. In Massachusetts, where I am, first part was that medical cannabis only was allowed as essential, not the adult use. They had closed down all the adult use stores, and we actually saw an increase in certifications because what had happened was many patients had let their cards not be renewed because of the adult stores being open. And what I found really fascinating was the liquor stores didn't close. Liquor stores have stayed open. And I really believe the reason is that if the liquor stores had shut down, we would have had the hospitals full of people going through withdrawal and seizures from alcohol abuse and alcohol addiction. And that's not what happens to patients or people that use cannabis. You're not addicted. Addiction of its own is an illness. So what we found is that they did allow also authorizations if doctors applied for a special exemption through the Cannabis Control Commission. We were allowed to conduct telemedicine. So we've been doing telehealth and telemedicine to do our certifications. And as far as research studies, the cytokine storm has been able to be decreased by CBD, has shown those effects. And that is a huge impact because at the end of the day, it's all about inflammation. You know, everything is itis, pneumonitis, gastritis, arthritis, bursitis, it's an itis. And by bringing down the inflammation, that's how you're able to protect people. And what I found in my experiences, most of my patients actually do smoke and they do inhale. And again, depending on knowing the source of your medicine and knowing that it's been tested and chemical free, those are the factors that make a difference. And if anybody ever has a concern, I tell them get a peak flow meter. Look at it before and after, and if there's a concern. And knock wood, I have not lost one patient to COVID. I've had patients that have had COVID, and they will tell me, Dr. Matt, I really believe the cannabis is what protected me and my symptoms were minimal and I was able to get through it much quicker.
Wow. Wow. Yeah, it really is incredible. In Colorado, we actually decided we weren't going to make cannabis essential, and then we had thousands and thousands of people down the block. And so basically, the governor, within 18 hours, repealed his saying that it wasn't going to be essential and made it essential because he realized the demand was so high. And I think this is a time where we have to do a lot of damage control with people, especially the fear factor, all of that stuff that's going on. And so it's really a beautiful thing to see how this is coming up. And what it really comes down to also is truth, because you can't hide truth. It's always going to come out. And so all the people who really have fought for this and know that they've been living their truth, it's kind of time for cannabis to live its truth. So it's a beautiful thing.
There's more to come. It actually is a solution for so many different things. And I just want to touch upon cancer. This is something that I feel adamant about. I mean, I cannot stress the fact that if you're willing to do chemotherapy, radiation, immunotherapy, steroids, and whack parts of the body often, why not incorporate cannabis? And this is where I say, I really believe when we hear that word cancer, cannabis must be an integral part of this treatment, because we know the appetite, the nausea, all the things. And why not give people a bit of quality of life, not only for the person that's dying, but also the family members that are around them. I really feel that's how important it is to die with dignity.
Me.
I want to talk about cancer and tell you a case, and also, what Dr. Uma said about the family. I've noticed with Alzheimer's disease, and it does slow the progress of that probably helps the family more than the patient, because it helps the patient deal with the sundowner and the anxiety. And in fact, there was somebody in my family who was in a facility, and I was prescribing Marinol for them because they were in a facility. And when the prescription ran out, they called me up and said, hey, this person is hard to deal with because of her anxiety. Please send us another prescription, which I did. The other thing is that, so I'm at a party, and this young man who's in his late 20s comes up to me and says, what do you know about cannabis and cancer? I said, well, not a heck of a lot. He said, well, my stepfather had cancer of the throat, and metastasized to the regional lymph nodes, and metastasized to rib and to the liver, and they're going to treat him for palliation now, not for cure. And we don't have anything to lose. So I told him, about the sort of the Rick Simpson oil thing, and I didn't think anything about it. And about 3 months later, I get a call from him, and he said, I just want to tell you, I made the Rick Simpson oil. I gave it to my stepfather, and according to the doctor, his cancer is gone.
Wow.
And it's just amazing. And the reason that cannabis works, there are three reasons. One is that it interferes with metastasis in the ID1 gene. It inhibits the ID1 gene. It inhibits the formation of new blood vessels, angiogenesis, and it promotes apoptosis, which is a fancy word for programmed cell death. There was a biochemist who had cancer who postulates that this apoptosis, this cell death, comes about because there is a phospholipid called ceramide, which is in higher concentration in abnormal cells, including cancer cells, and that when you take cannabis, it increases the amount of ceramide in the cell and kills the cell. In other words, as Dr. Uma said, chemotherapy and radiation and other treatments have very unpalatable side effects. Whereas with cannabis, okay, you might get a little high, you might have a little nausea and vomiting, but the side effects compared to these other interventions is minimal. And as Dr. Donald Abrams, who's an oncologist at UCSF, says, there's more than enough basic science and anecdotal basic science studies and anecdotal reports to justify doing double-blind studies, which, again, as Dr. Uma mentioned, we're not doing in this country, and we need to be doing them.
Wow. That's really incredible. I actually took care of my 14-year-old brother while he was sick with cancer. He was diagnosed, it was actually testicular, but it was a type of cancer called cariocarcinoma, which is the very beginning cells of life. And my brother was 14. So as those cells were reproducing, I would stick cannabis, I would juice for him, and I would stick cannabis inside of his stuff, really against my family's will. I come from a very strong Christian family who, at that time, 10 years ago, thought cannabis was really bad. And I was also using it to really deal with the trauma of this child being so sick. And I could not believe the quality of life that my brother had in his last moments because of cannabis. I mean, it was almost like just completely different days. He could walk, he could talk better, whereas if he didn't have it, I mean, he would sleep trying to sit up with pillows. I mean, he was never comfortable. So I know firsthand that it truly works. And even like you guys said, giving that last little bit of quality of life, which is so important.
Let's talk a little bit about Christianity. The Coptic Church has postulated, and you can check it out online, that Jesus of Nazareth used cannabis as one of his emollients. And it certainly makes sense. If you take a look at leprosy, that it could deal with the skin lesions related to that. He also dealt with the person that had seizure disorders, and that responds to cannabis. So the possibility is that cannabis was a part of what Jesus of Nazareth was using. So I think that the Christians have a reason, more reason to use cannabis than us non-Christians. And I don't know how your family feels about this now, but I think they might want to take a look at the history of Jesus of Nazareth. Anyway.
It's funny because I called a friend of mine named Craig Black and I said, listen, Craig, can you tell me if my brother is going to die? He was an ER doctor at Holy Cross Medical in South Florida. And he told me, I told him everything that was happening. And he said, Chloe, you give him cannabis. And I said, but he's only 14. It's the first thing I said to him. And he goes, trust me, give it to him. And so that's kind of when my relationship with the plant really changed. And I think that that's wonderful. And on that topic, where people feel guilt or, the Christian thing, God wouldn't want you high or those type of things. I think it's so important for people like us three who are educators in this space and really we're meant to get this information out there to people so they would know. I remember one of the ladies that was my mom's very best friend from church, she messaged me and said, Chloe, I have horrible menstrual cycles and I've really prayed about it and God told me it's okay to use it. And so I think that they're coming around, and even my family now has a very different outlook on the plant than they did before, as all of this information has been made available.
Right. It's really a shame that we have been bamboozled by 100 years of propaganda. And I go back to Dr. Woodward and his testimony for the AMA against the Marijuana Tax Act in 1937, and in which he said the AMA knows of no dangers from the medical use of cannabis. And that was at a time when in the 1920s, American physicians were writing 3 million prescriptions a year that contained cannabis, and there were over 25 patent medicines on the market that contained cannabis. And a lot of people think maybe people think about conspiracies too much, but that this was the Marijuana Tax Act had nothing to do with cannabis and everything to do with hemp, and that it was a concern on the part of the petrochemical industry, particularly DuPont, about Ford's hempmobile, a car that skin was had an acrylic embedded with hemp, the upholstery was made from hemp, and it ran on hemp ethanol. So the oil companies may have had a hand in the Marijuana Tax Act. Anslinger gets way more credit than he deserves. He was just a bureaucratic opportunist, and I facetiously say he was the greatest bureaucrat of all time because he created a problem where none existed and was able to increase the size of his bureaucracy because of his propaganda.
Mm-hmm. Emmanuel, can you, yeah, perfect. Okay, so I want to go into the educational part a little bit with you too. I want to discuss why educating doctors is so important. We've discussed, Dr. Bearman, the punishment that doctors can receive from the medical board for recommending cannabis. And you just mentioned a 9-year-old, story of a 9-year-old kid. Why is it important for us to start educating doctors and really opening up this space to allow them to be able to start recommending cannabis and not pharmaceutical drug prescriptions that cause addiction?
Well, it's important for one thing, because having to do battle with the medical board, as I did and won, is expensive. The medical board didn't say, "Oh, here's the money you had to pay your attorney in order to protect patient privacy." The patient said they didn't want to release their records, and the appellate court said that the medical board didn't understand Prop 215. They didn't understand their own enabling legislation. They didn't understand the letter of recommendation that I wrote. And they didn't understand the Constitution of the state of California. And yet nothing adverse happened to the medical board. So I am very empathetic with doctors about their reluctance to get into this. Now, there was a case in the Ninth Circuit, Conan versus Walter, which said that doctors don't check their First Amendment rights at the door when they get their MD degree, and that if a patient asks you what you think about cannabis, you can tell them what you think about it, whether it's good, bad, or indifferent. So the endocannabinoid system is the largest neurotransmitter system in the human body. Why aren't we educating doctors about that? And of course, the other thing is that we got along perfectly well without manufactured pharmaceuticals until about 1896 or 1897, when aspirin and heroin came along and Bayer put them on the market. So we ought to take a look at plant-based medicine. Naturopaths, sometimes are considered to be people who weren't smart enough to get into medical school. They're pretty damn smart. What Hippocrates said is medicine is food and food is medicine. And we need to go back to that. And of course, the other thing is, as a physician, a patient comes in and tells you, "Doc, this plant makes me feel better." And if you tell them, "That's terrible, stop taking it, I never want to see you again," well, you've lost a patient, and you've lost an educational opportunity. Rather than, as Dr. Uma and I say, "Well, tell me more. How much are you taking? How much better do you feel?" That is solidifying the doctor-patient relationship, and that patient is going to pay attention to other advice that you give them, and they're probably going to give some word of mouth advertising for you. So I can't think of reason one why the medical schools shouldn't talk about the endocannabinoid system and shouldn't talk about plant-based medicine, and frankly, shouldn't talk more about Marinol and Dronabinol, which are synthetic THC. I mean, they've been approved by the Food and Drug Administration. So what are they afraid of?
Right. Dr. Uma, I know you do not prescribe pharmaceuticals because you feel so strongly about this. So to hear.
I've not had to. This is where people say, "Dr. Uma," I said, "Listen, when I have another option, why can't I use that? I am a licensed physician." And when I first started to write recommendations in July of 2012 in the state of Washington, I did it because I still feel the sadness that I did not give this plant to my mother. And she died of an illness known as idiopathic pulmonary fibrosis, which is a fancy term for we don't know what caused your lung disease. And I still remember her when I first learned about this was because of my mother. And she's saying they're using ganja. And it was a TV show about how it was being used in Israel for COPD, asthma, lung cancer, and PTSD. This is what they knew then. And I still remember the knock on my door saying, what? You know, that question and the aha moment. And you find out the history that asthma cigarettes was what they had. And what was in those asthma cigarettes back then was cannabis. I'm originally from India. William O'Shaughnessy first learned about this sacred plant from my country. He learned about it in Calcutta. He saw the Ayurvedic doctors use this medicine for things like tuberculosis and so many different ailments, and brought that knowledge to Europe and here. And so my mission is to change the stigma regarding cannabis and for the world to know about the endocannabinoid system. And I do it through education. And that's why I am so passionate about us understanding this, and every healthcare provider must know about it. And I really think it should be mandated in the states, at least where we have a medical cannabis program. And that's the word we should be using, cannabis and not marijuana.
Mm-hmm. And Dr. Uma, you just wrote a book called The Exit Drug.
Well, we're getting it out. It's called Cannabis, the Exit Drug. And I call cannabis the exit drug because I have shown that we can help people exit. And it's an exit plan that we put together to get off of pharmaceuticals. Narcotics is what I originally started saying in 2012. And now, in the last 6 years, I've added alcohol and nicotine because we're using this for an improvement in your quality of life. And also the exit part, like we said about cancer or death and dying. I feel that that should, again, be that part that should be incorporated in hospice care and senior care for end of life as well.
Right. Could you imagine how great that would be if everybody at the nursing home could get together and, consume cannabis and they all felt better? I mean, it really could. And it's sad that it has such propaganda, as Dr. Bearman says, because it really, it just gives such huge quality of life toward those end years.
I love what I do, Chloe, because honestly, when I did family practice, I used to dread when I knew a senior was coming in because I would fear how many pills they were on and how many conditions I would have to write in that assessment plan of my notes. And now I have a joy because it's like, well, we got rid of one more pill and they're peeing and pooping. And, that is essentials of life for some of our seniors, and sexual activity and sleeping and being active.
I just want to say how much I respect Dr. Uma and her philosophy and her enthusiasm and her energy. There was a study in Israel at a residential care facility, the first one in Israel that incorporated cannabis into their treatment protocol. And what they found was that these people in the residential care facility had better appetite, slept better, had less anxiety, less depression, and they used 20% fewer prescription medications. You're talking about an exit drug before. I have a patient who is an assistant district attorney who has not had a drink of alcohol in over 20 years, and he attributes that to his use of cannabis. And he's not the only person with alcohol. And I've had people come in and say, I'm in AA, I still am in AA, I know they don't approve of other drugs, and I'm using cannabis because it helps me stay away from alcohol. Also, there are at least 4 states which have approved cannabis for opiate use disorder. Can I have the picture back on me? Because I got something I want to show here. I don't know. I'm looking at Dr. Uma. Anyway, this is an ad for Canadana, which is a cigarette that was available in the 1920s in Australia. There also was a cigarette from India called Garibaldi, I think, and another one from France called Cigars de Joy. And all of them advertised as being useful to treating COPD and asthma. And when we think about it, cannabis is both a bronchodilator and an anti-inflammatory, just as many prescription drugs are. And, Dr. Uma hit on a point that isn't made often enough, and that is that
Uh-oh.
We can't hear you, Dr. Bearman.
Yeah, I think we lost your audio.
yeah, that you can, Dr. Uma has shown that you can decrease your reliance on prescription medication. And that's something that I know I don't talk about enough. It's something that I'm aware of, but I think that it's something that it's important that we're talking about it here.
It's really interesting because honestly, people come in and they don't think that that's going to happen. And we could show year after year. Today, I mean, this is what I love about my patients, because my philosophy is reach one, teach 10, teach one, reach 10. Because my patients will say to me, Dr. Uma, I was on 6 pills, I'm down to 2 pills, and that's only been in 3 years, and I've been going to a doctor for 20 years, and they never had an exit plan for me. There was never a date when we talked about how we were going to lower some of these meds. It was only about, let me renew that prescription for another 6 months or another year. So doctors also, I feel like we're at a point, and right now in Massachusetts, I'm very proud of my colleagues. They've created me as the point of contact for medical cannabis as the expert. So this is a start to help introduce my colleagues to saying, listen, I know you don't have the time. I mean,
This wasn't just your colleagues. This was the Massachusetts Medical Society.
Yes.
And you're being a little bit too modest here. That you were an official spokesperson for the Massachusetts Medical Society.
Thank you, Dr. Bearman. Yes, and it's taken me time, and these are my colleagues that I've known for over 22 years, and some of them still don't understand, even though I see some of them as patients and their family members. And I am a true family doctor, and I love that because, we get to see one patient and the word of mouth gets out in the family because they're feeling good and they want to know how. And, when you see another family member improving, that lessens your burden as well as a whole entity.
True.
Yes.
True.
Well, we actually have to wrap up. So is there any last minute things you guys want to say before we bring on the next panel?
Well, I want to encourage the doctors that are out there, or the people, the activists that are out there, to consider joining the American Academy of Cannabinoid Medicine. Go check our website. And also there's a virtual conference going on called the Whole Plant Expo, and you might want to check that out. We have a booth in the non-profit organization pavilion. One of the things that I found is that the way to get doctors to appreciate that cannabis is a medicine is to ask your doctor about it. And there are probably 700 doctors in Santa Barbara County, maybe 400 of them in southern Santa Barbara County. And I'd say at least 100 of them, and of course a lot of them are not primary care doctors, have referred one or more patients to them. And it's because they know that I know what I'm talking about, and because they want to take care of their patients who are asking about this, and they know that, hey, here's somebody who is credible and may be able to help them. So I think that it's important for people to tell their doctors that the cannabis is useful, and to ask them for recommendations if they're in a state where they are required. I also would encourage anybody who wants a little bit more information on the history. There is a video called Medicinal Cannabis and Its Impact on Human Health, and that's very good. And also, if for an introduction to some of the science, is I gave a presentation about 10 years ago at the University of Wisconsin called cannabis and cannabinoids in the 21st century, and that's also something where there's a lot of good videos out there. I'm just kind of pushing myself. And lastly, as long as I have the commercial space here, I've written a book called Cannabis Medicine, A Guide to the Practice of Cannabinoid Medicine. And it's something that interested patients should look at, and any healthcare professionals that have a greater interest in this ought to take a look at.
Perfect. And we're going to be working with you with the university as well. And so if you want, you can also send me those links and I can post them on our page so everybody can, where to buy your book, any talks that you would like us to put the links out there for you. And that way everyone can start to get to know you, as we're going to definitely be seeing you around a lot more.
Thank you very much.
And they can reach me at Uplifting Health and Wellness. And I'm very excited. Dr. Bearman and I are going to be speaking at Dr. Raphael Mishulin's 90th birthday. He will be celebrating, and that conference is October 26th to the 28th. And we are a part of that. So we're very excited as well. And there'll be more announcements coming from the American Academy of Cannabinoid Medicine regarding regional coordinators that will be appointed, and more education is on your way.
So I do want to mention that Dr. Uma is one of our regional coordinators, and we're very happy about that. The regional coordinators is to give us higher visibility in various areas in the country. Dr. Bregman is in Colorado, and we have other doctors throughout the country. And we hope that they will help us educate physicians as well as possibly patients in their area. And I want to thank Dr. Uma. She has been a great educator and really tireless, and have an enormous amount of enthusiasm for the plant, and just does a fantastic job.
Oh, and I want to thank you both for being here today, and
Thank you.
I look forward to working with you guys more.
Thank you, Chloe, for having us here today.
Okay.
Thank you very much.
Bye.